Before I start, I would like to thank the organizers very much for this opportunity. ELPA has been in existence for over 10 years now, and as you have indicated, we look at a variety of liver conditions. So although there is a lot of discussion, rightly so, about hepatitis C, we actually cover the whole range of the different liver diseases that make up liver disease as we know it. We're an umbrella organization, which means we have 34 members. These are not people, they are organizations themselves. So in Romania, we have 2 associations that we work with closely. And in response to the question about what does our work actually involve, there's various levels. I mean, obviously there's the capacity building side of things, where, for example, we work very closely, in particular with one of our Romanian members, to educate them in what is needed so that the work they're doing at national level can have an impact at EU level, but also an impact within ELPA. You know, our members learn from each other, and I think that's perhaps one of the greatest assets of an association. We also do what we call policy work, which is looking at why is it important that there are policy developments that have a realistic impact on patients, but also have an explanatory background that is based on fact, based on literature research, based on real studies and data. Sometimes patients we don't have the knowledge. I mean, there are big gaps in what we know or how we can use what is available. So for example, one of the things we've done recently is we've commissioned an economic study on hepatitis C and the treatments that were available until 2014. They don't take into account the new treatments, but that's simply because of when we started the work. And this particular economic study looks at France, which obviously has done amazing work in hepatitis C with the strategy plans that the countries have implemented up until 2012. And then on the other side, we looked at Romania, where unfortunately there's so much to be done. So this work will be published. It's already actually been pre-launched, but we will have some copies of the study next month available at the International Liver Congress. So that's some of the work that we've done. The other type of work that we do is we try to help our members to understand the importance of guidelines, not just the national ones that exist, but also the international, particularly the European guidelines, and the importance of ensuring that patients are aware of their existence, so that they can then have an informed discussion about their treatment options. Obviously, some patients don't wish to go into that level of it, but certainly for our work, it's important that the European guidelines that EASL does are taken into account. We also do scientific work, and one of the things that we do is we work with EMA. We do actually have an official presence in some of their working committees. Obviously, in order to be part of that, there are several rules that we need to fulfill, particularly in relation to finance and transparency. As a lot of patient organizations, we depend substantially on our partnerships with industry. So the fact that there are these rules and regulations help us ensure that we comply and that the way in which we work internally is structured. This obviously cascades to our members as well, because they are aware that this is what has to be done in terms of our budget. So we cover a sort of range of activities. We do capacity building for our members. We talk to them about strategy plans, about the importance not just of looking at treatment, but of looking at the whole pathway, which is, you know, prevention, case findings, the treatment, etc. So we cover a wide range of areas.
Also, I have a couple of questions to none of you in particular, essentially addressing all the panelists. One is, we've heard in previous panels how technological changes, and Mariusz also addressed this, that we're living through a paradigm shift where the relationship becomes far more personalized, the targeting of specific individuals. Is that a threat to the general nature of patient associations? Is that a tool that you can use, or is that just a complicating factor, but ultimately not a major impact? And my second question, not directly related to this, is going back to this dichotomy of role between European level and EMA and the national agencies. How do you see the role of the patient associations in shaping that dialogue, national European, and also the addressing what Mr. De Lorenzo was mentioning, considering the economic access and sophistication of system differentials between EU member states, and how to take that into consideration. Thank you.
I will take some time first to respond to some of the issues that were raised. First of all, the one thing that struck me was your comment about patient organizations as consumers. And I would argue that that has changed a little bit. I think we also, we do provide things. We don't just consume. And we do have a voice, and I'm sure you agree. I'm sure it's just a question of wording. The other issue, and I will not get into Romanian, how associations work here because my knowledge is not good enough. However, what I can say is, as part of our remit, what ELPA does is we help people set up patient associations. So we're involved in what is actually in some countries a very difficult process. I mean, we mustn't forget that in some countries, what we call a patient association, when it joins ELPA, is sometimes just one person. It's one person that is affected by the disease and has decided that something must be done. So this person has gone to the trouble, and I'm sure it's the same in all countries. So they come to us, we help them in the sense that we provide advice with, you know, what do you need to do in legal terms to comply with ELPA's internal regulations for membership. We also, because normally, even though there aren't patient associations necessarily, we have contacts beyond that one person that has taken the initiative to contact us, who is willing to do what is a lot of work behind the scenes to set up a patient organization. So while yes, sometimes there are issues in, you know, what kind of why is this one person setting up an association? Sometimes the gap between what the person or the association is doing and the way they're able to disseminate the information in terms of the transparency and the budgets and where the money is spent is simply due to the lack of capacity. I'm not saying that's always the case, but there are some areas where this is happening. And in terms of transparency of budgets and funding received, I think as umbrella organizations, we play a role because we are accountable. I mean, I know from the ELPA website, we have the breakdown of percentages. We have to, otherwise we cannot work. And I will be honest, there was one year when it didn't go up on the website, and our members asked us about it. They said, listen, at national level, we're being told about this. Why aren't you doing it? So, of course, we had to admit, oops, the person doing the website forgot to update it, and we weren't checking it on a regular basis. So there are all these issues that need to be considered. With regards to how we work between the EU level and the national level, what we tend to do is bring all stakeholders together. I mean, we firmly believe we all have a place in the platform, and it's about discussion. You gave a very good example about the work that you're doing at EP level with Christian Busoy, and we're doing similar things in terms of liver disease. And the way that links up to the national level is that we have had meetings here in Romania. I wasn't present, but my other colleagues were, where we did try to bring all the players, all of the stakeholders together to have an open discussion within the sort of the realm of what is, at the end of the day, something that will benefit all of us. I mean, if we can all agree on strategies and we can agree on how to do things, the path will be much smoother if all the stakeholders are involved. Obviously, it varies from country to country how well that works, but certainly that's our goal.